Hello, my name is Andrea Sinclair, and I want to include some information that I did not speak of in my first video regarding cranial bones and the 14 facial bones. I would like to mention, I'm going to lift up my model. I'd like to mention regarding the external occipital protuberance. I want to make mention that this provides attachment. The external occipital, as I mentioned earlier, is in the back. Well, that protuberance is like a ridge on the skull, and it provides attachment for certain muscles, occipital meaning around the eyes. I'd like to mention a few features of the temporal bones. You have on the external view, the temporal bones, external views, temporal mandibular joint that connects the mandible with the rest of the skull. You have the mastoid process, styloid process, external acoustic meatus, and the squamous part. I'd like to mention that the petrous part of temporal bone, the structures that are housed within the part of this temporal bone, the structures are the ear cavities that it houses. And also what passes through the internal acoustic meatus are the cranial nerves, 7 and 8. Now to mention the sphenoid external view, lateral and orbital parts, greater wing, lesser wing. For the superior orbital fissure, I'd like to mention that what passes through this opening is a long slit between the greater and lesser wings. What passes through is the cranial nerves. The internal view, lesser wing, greater wing, is the project lateral. You have the optic nerves that pass through the optic canal with the sella turcica. The structure that sits in the fossa is the pituitary gland. Now I'd like to mention the ethmoid bone. There is a feature that I failed to mention in my first video, the crista galli. What it basically does is secures the brain in the cranial cavity. The cribriform plate, what passes through there is the olfactory nerves. The olfactory nerves are responsible for our sense of smell. I'd like to take the time to mention sutures, which I don't have a view really good for this model. But the sutures, I'd like to mention we have 4 sutures. Coronal, the parietal bones meet. Let me see if I can point that out. The parietal bones meet there. The sagittal, which is the midline, meets at the cranial. The labdoid, parietal bones meet at the occipital bone, so the labdoid suture would be in the back. And the squamous, it's the parietal and temporal where both of those bones meet. I'd like to mention, as far as the facial bones, the zygomatic, 2 bones form the prominence of the cheeks. The vomer, what 2 bones form the bony nasal septum, would include the inferior nasal concha, and that lies in the lateral walls of the cavity. The mandible, we have features the body, the angle ramus, the mandibular condyle, which is I want to mention that's an articular point, the mandibular notch, the coronoid process, which are insertion points for the temporalis muscles. And let's see if I can lift up my model to display the vertebrae. We have 4 curves of the adult vertebrae section, beginning with the cervical in the neck, point toward the neck, thoracic, which would be somewhere in there, the lumbar, which is the back, and the sacral, which is more toward the hip. The cervical vertebrae has 7, beginning at the very base of the skull. And the atlas, what does this bone articulate with the superior, would be the occipital condyles. All right, thank you. This will conclude this presentation, which is really part of the first presentation. Thank you. Hello, my name is Andrea Sinclair, and welcome to my appendicular skeletal model video. What I will start off with, first of all, is the discussion regarding pectoral girdle. The pectoral girdle is a collection of bones, as I will demonstrate on my model, collection of bones. The clavicle, this bone right here, and the acromial end there, and the sternal end. The sternal end somewhere in the middle. This allows this houses the particular joint referred to as the synovial joint that provides substantial range of motion. As you can see, this has a substantial range of motion. It's well lubricated, and that is the name of that particular joint. We'll start off with the scapula. I think I'm going to turn my model this way so that you'll get a better view of the scapula. With the scapula, we have the coracoid process, which I think I better turn it to this view better. The coracoid process, which is a bony point. Subscapular fossa, which is somewhere in the center there, scapula fossa. Glenoid cavity is rather flat in the scapula. You have the spine, which is the outside of the wall of the scapula. The acromion, there again, it's the bony point where the humerus meets. The acromion, it's sort of knobby. Supraspinous fossa, somewhere in there. Infraspinous fossa, a little bit lower there. Sternoclavicular joint, there again you have the sternum and the clavicle. The acromioclavicular joint would be located somewhere in there. Okay, this will take us to the arm, which is referred to as the humerus. My point right there, this arm, humerus. Okay, the head, always at the top. We have the greater tubercle, which is a ball. Lesser tubercle, a smaller ball. Deltoid tuberosity, somewhere in there. I don't know if I can point that out. It's kind of hard. Medial epicondyle, somewhere in the middle there. Lateral epicondyle would be side. Coronoid fossa. It's a dip that allows the ulna to move freely. So we have on the model, it's like a depression, and it allows the ulna to move freely when the elbow is extended, which will demonstrate the extension there. So that particular process is called the coronoid fossa. The capitulum articulates with the radius. Let me see if I can raise that. The radius. And the trochlea, which is in this bone, it connects with the ulna, which would be the smaller bone there. The olecranon fossa, what goes there is the elbow. So let me see if I can point there, elbow. Okay, where the bend. Okay, the forearm, ulna. Let me lift my model. We have the ulna. We have there again, the olecranon. We have the coronoid process, which is always a pointy area, and the styloid process, somewhere right in there. The radius, which is the other bone. We have the head right there. The radial tuberosity, it's like a groove on the radius. and the styloid process somewhere there. Okay, let's get to the carpals, or the carpus. Okay, let me see if I can aim this. Okay, the carpus, the proximal row, which is closer to the joint, lateral to medial, would be the scaphoid, lunate, triquetral, and pisiform. Right there, I think. Proximal. Distal, which would be further, houses lateral to medial, the trapezium, trapezoid, capitate, and hamate. Okay, let's see if I can, where my finger is would be more of the distal, and if I lower it, my other finger right there would be the proximal row, which is closer to what forms the wrist bones. That would be the proximal row, the bones. And then the bone that forms a joint with the pollex, which is another name for the thumb. These little bones are sesamoid bones, where I'm holding. The metacarpals are bones right in here, and phalanges as we go down the model's hands, phalanges. Okay, now we want to get to the pelvic girdle, the coxal bone. The coxal bones, I'm going to point out approximate borders, the acetabulum, the pubic symphysis, the obturator foramen, the iliac crest, the ear-shaped part of the hip bone, anterior superior iliac spine, which would be the spine part, iliac fossa, lining, greater sciatic notch, somewhere along there, which houses the sciatic nerve, ischial spine outside of this model, ischial tuberosity somewhere in there, which makes up your pelvic girdle. Now we're going to go to the femur. The femur thigh bone, head always at the top, greater trochanter, the bony areas, lesser trochanter, abductor tubercle, the medial epicondyle, lateral epicondyle, middle points, medial and then lateral, which is the side. Medial and lateral condyles, these grooved areas, patella. I'm going to put this forward, patella, kneecap. Okay, then we come across the our next set of bones. I'll try right here. Next set of bones, the tibia bone, medial and lateral condyles, which are at the top, tibia tuberosity in the middle, medial malleus, which is below, and the proximal distal tibiofibular joints, that would be above the foot. Which, okay, sorry for this. Okay, I think I'm gonna try this angle. Okay, the foot. All right. Okay, let's get to the fibula. Once again, we have the head, lateral malleus, which would be on the outside. Now we're going to try the foot again. The foot, okay. We have, I'm going to just show the calcaneal first, which is the heel. The cuboid somewhere in the middle of this foot, somewhere in the middle. Okay. Somewhere in the middle there is the cuboid. The navicular would be on the top of this model. The medial, intermediate, and lateral cuneiform bones I'm gonna see if I can turn this sideways. I apologize. Really? Okay. Medial, intermediate, and lateral cuneiform bones. Metatarsus would be somewhere in there where I'm pointing. The phalanges, like the hands, further down, and the hallus. You have the large toe, the hallus. Okay, and this will conclude my presentation on the appendicular skeleton. Thank you for your attention.